Welcome to tonight's CPD webinar on Better and Faster Access Share by Default with My Health Record. My name is Yvonne Chong-Costa, Digital Health and Quality Improvement Manager at CESPN, and joining me tonight is Kayla Waldy, Digital Health My Medicare Support Officer, who is also a qualified speech pathologist. Before we begin, I would like to start by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognise the continuing connection with land, water and community and pay my respects to elders past, present and emerging. I would also like to extend that respect to any Aboriginal colleagues joining us today. I've got some housekeeping instructions on screen. For Q&A, please click the button as you can see on screen. The chat button is disabled. Your participant audio and videos are also disabled, and this session is being recorded. Evaluation form will be sent to you after the event and also via email. I'll quickly go through the next few slides that highlight upcoming events and networking opportunities you may be interested in. We've got Headspace 24th in February, the e-referrals to Sydney LHD and SR referrals March 3rd, and CPR skills for general practice on Monday the 2nd of March. There's general practice networking events coming up, the practice manager networking event, practice nurse networking event, and GP registrar and GP supervisor networking dinner. We also have a series of cultural awareness training on Wednesday the 25th of March, Wednesday 24th June, and Wednesday 4 November. So let's begin. On the agenda tonight, we'll broadly cover My Health Record, a bit of a quick refresher and what's new, how sharing information supports better and faster access, what this means for healthcare providers, and what this means for consumers and patients. Before we can better understand the Better and Faster Access initiative, it's useful to reset why My Health Record exists in the first place. My Health Record was created to address a very practical problem in healthcare, information being scattered across systems, providers, and settings. As you know, patients move between GPs, hospitals, specialists, allied health, and pharmacies, but their information often doesn't move with them. That leads to repeated tests, incomplete histories, delays in decision-making, and risk to the patient's safety, especially during transitions of care. The My Health Record was designed to improve access to information so clinicians can make safer, more informed decisions when time and context matters. On screen is a visual timeline showing the development of My Health Record from its inception to today. Please note this timeline is from 2012, however the early vision was actually from 2008. In 2010, the National eHealth Transition Authority, also known as NETA, was tasked with creating a secure national electronic health record system. By 2012, the Personally Controlled Electronic Health Record, known as PCEHR, was launched under the Gillard government. The system was voluntary. Individuals had to opt in to create the record. It allowed patients and healthcare providers to share key information such as medications, allergies, and medical history. At the time, uptake was very low. In 2015, around 2.5 million Australians, roughly 10% of the population, were registered. In 2016, the PCEHR was renamed to My Health Record as part of the broader reforms aimed at improving usability and increasing engagement. Oversight was transferred to the Australian Digital Health Agency. This shift coincided with national push to strengthen and expand digital health initiatives. From 2018 to 2019, the opt-out model was announced, and there was a national rollout. The system moved from opt-in to opt-out, meaning every Australian automatically received a record unless they chose not to. This was a major policy shift, supported by both federal and state governments. At the time, there was public concern and strong debates about privacy, data security, and law enforcement. The government made several legislative amendments to strengthen privacy protections. By early 2019, the opt-out period ended, and over 90% of Australians had a My Health Record. Of significance was the COVID-19 pandemic, whereby the My Health Record became a central tool for storing vaccination certificates, COVID-19 test results, and digital health summaries. Many of us have strong memories of the early days of My Health Record, and not all of them were positive. However, over time, the focus shifted from being hospital-centric to supporting primary care and continuity of care, particularly around shared clinical documents. What's important to note is that while the system has evolved, some fundamentals have remained consistent throughout: patient choice, clinician control, and privacy safeguards. Patients continue to have control. They can choose whether to have a record and what's visible. Clinicians are not required to rely on My Health Record for decision-making. It's a support tool, not a replacement for clinical judgment. And privacy and security safeguards remain central to how the system operates. With more than 24.6 million active My Health Record accounts nationally as of December 2025, and broader participation across the health system, healthcare providers now have access to a much larger volume of clinically relevant information. This includes more meaningful interactions such as accessing, sharing, and reviewing key documents, as well as improved integration with clinical software compared to previous years. For context, Australia's estimated population in 2025 was 27.49 million, meaning the vast majority of Australians now have an active My Health Record. Patients are also becoming more engaged with their own health information. They can now view much more of their data, and that's increasingly shaping expectations around access, transparency, and involvement in care. We're also seeing consumers contribute more actively, as shown on this slide. More than 605,000 consumer-generated documents have been uploaded. This slide also highlights the overall volume of documents now in the My Health Record system. So while many health records isn't perfect, it has evolved significantly from the version many of us first experienced. That progress is important context as we talk about access and how the system continues to improve. This slide shows how different parts of the health system use My Health Record, and overall we're seeing strong uptake across most sectors. One of the key areas of growth is specialists. Nationally, 69% are registered and 41 have used My Health Record. Here at CESPN, we've invested a lot of effort into engaging specialists. Out of the 1,806 specialists we have on our database, 404 are currently registered to use a My Health Record. While there's still progress to be made, we're seeing steady improvement, particularly as more specialist software vendors integrate with the My Health Record. Aged care is another sector with significant opportunity. Nationally, 55% of aged care services are registered and 17% have access to My Health Record. With increasing emphasis on shared care, medication safety, and smoother transitions of care, we expect this engagement to continue to grow. In CESPN, regionally specifically, we have around 148 residential aged care homes, and about 50% are registered with the My Health Record. Looking ahead, Allied Health is next in line for broader My Health connectivity. Late last year, the Australian Digital Health Agency introduced an industry offer to encourage software vendors to make their systems compatible with My Health Record and electronic prescribing. The expected timeline for this expanded connectivity is June 2026, which will open the door for a much wider range of clinicians to contribute to and benefit from shared health information. Let's talk about the My Health Record and how it can be effectively used in everyday practice. This slide outlines the full range of document types available in the My Health Record. Having this overview is helpful because it shows just how many different sources of information you can draw from when you need to quickly understand a patient's history. My Health Record is particularly valuable when you need a snapshot of a patient's health information, for example, during unplanned care, after-hours presentations, or when seeing a patient for the very first time. Being able to access medication information, discharge summaries, pathology and imaging reports, and shared health summaries can support safer, more informed clinical decisions. It's also really useful for identifying medication discrepancies, seeing recent hospital interactions, and supporting continuity of care when patients move between providers. Importantly, My Health Record works best as a companion to your own clinical software. It's not designed to replace existing systems, but rather to complement them. Using it alongside your usual workflows allows you to cross-check information, fill gaps, gather additional details from other healthcare providers, and in some cases from the patient themselves. This last slide in this section is on how to access My Health Record. For healthcare providers, it's either via conformance software, in this case GP software, such as Medical Director or Best Practice. It's also accessible through the National Provider Portal. However, you can only view and not upload documents this way. So let's move on to unpacking better and faster access. But before we begin, I'd like to focus on the access challenge. We talk about access in primary care. It's not just about getting patients through the door, it's about whether clinicians have access to the information they need to provide care. A common challenge is not having timely access to pathology or imaging results that sit outside of a practice system. Instead, clinicians are left chasing information, calling radiology providers, waiting on faxes or secure messaging, logging into multiple portals, or relying on patients to recall what tests they have done and where. More and more patient expectations have changed. Many patients assume their results are immediately available to every clinician they see. They become understandably frustrated when decisions are delayed simply because information isn't accessible in real time. This shift in expectation places additional pressure on clinicians and practice staff who are already managing increased demand and complex workflows. This in turn creates added pressure on clinicians, more time spent tracking down information, greater cognitive load, and in some cases duplicated tests, all of which affect workflow efficiency and overall job satisfaction. So what do we mean by better and faster access, and what do these changes look like in practice? I'd like to walk you through the two key reforms: sharing by default, which enables better access, and faster access, which focuses on when consumers can see the results. I'll also briefly explain what these changes mean for clinicians and patients. Share by default, better access is a legislative change that underpins better access by making certain health information available in the My Health Record automatically. Under the new rules, pathology and diagnostic imaging written reports, such as blood tests or x-rays, must be uploaded to the My Health Record by default. It's important to be clear that this requirement applies only to written reports, not the diagnostic images themselves. Initially, this obligation applies to pathology and diagnostic imaging reports. However, other types of health information may be added in future, following further consultation by the Department of Health, Disability and Ageing before any expansion to additional providers or document types. The legislative framework that underpins these changes are changes introduced through amendments to My Health Records Act 2012 and the Health Insurance Act 1973. Under the My Health Records Act, healthcare providers for organisations that they work for may be required to upload certain types of health information. At commencement, this applies only to pathology and diagnostic imaging reports. Under the Health Insurance Act, providers delivering certain services must ensure the associated health information is uploaded to the My Health Record in order to claim Medicare benefits. Where an organisation uploads on a provider's behalf, this requirement is considered met. Faster access. The second major change relates to when consumers can see the results, supporting more timely access to their health information. This slide elaborates on faster access. From mid-October 2025, most pathology results were available to consumers to view in the My Health Record or the 1-800 Medicare app immediately after they were uploaded. Previously, a 7-day delay was in place, with exceptions for specific tests, such as COVID-19, respiratory infection tests, diabetes monitoring, and INR blood clot monitoring. More details on specific types of tests that will be immediately available to consumers can be found on the link on the slide. Certain categories, including anatomical pathology, cytopathology, and generic tests, results will be available to consumers after a 5-day delay, regardless of test outcome. From February 2026, consumers will be able to immediately view X-ray reports for limbs, so this means arms and legs, as soon as they are uploaded. All other diagnostic imaging reports will be visible after a 5-day delay, reduced from the previous 7-day wait. It's important for prescribers to be aware imaging results will now become available to consumers at the same time they become available to the treating clinician. And if there is a delay in release, this does not indicate an adverse or abnormal result. The delay applies regardless of whether a result is positive, negative, within the normal range, or outside of it. One key consideration for providers is how to support patients who may view their results independently. It can be helpful to give patients clear guidance about what to do once they see the results, especially if any values fall outside a normal range. Reassure them that not all abnormal results are a cause for concern and that clinicians will still contact them directly if urgent action is needed. Where relevant, it can also be helpful to explain how the results fit into a management of their ongoing conditions and what the next steps in their care might look like. So what does all of this mean for providers? For clinicians who request pathology and diagnostic imaging, it will now be increasingly useful to check the MyHealth record before ordering new tests for patients. As more reports are uploaded by default, you'll be able to see results ordered by other providers or organizations, often in real time. This has several benefits. It supports better informed clinical decisions, reductions in unnecessary repeat testing, faster diagnosis and treatment, avoiding delays, improved continuity of care across private. These changes stem directly from the recommendations in the Strengthening Medicare Task Force report, announced in May 2023. The Australian Parliament has since passed the relevant legislation with the goal of making MyHealth Record a more reliable, timely and useful resource for both clinicians and patients. Overall, the intention is to create a more connected system, one where critical information is easier to find, easier to share, and available when needed most. So commencement. Some aspects like faster access to results are already being implemented as mentioned previously since October 2025. However, the mandatory requirement to upload written reports by default won't be enforced until the rules take effect, which expect to be in July 2026 onwards. What does this mean for clinicians? From July 2026, clinicians will see changes mainly in how results are shared rather than how care is delivered. Pathology and diagnostic imaging written reports will be uploaded to the MyHealth record by default. Consumers may see the results earlier and more consistently. Clinicians may need to be prepared for patients accessing results before or between appointments, and also be prepared for more informed patient conversations. There are also important exceptions. Information does not need to be uploaded where the patient does not have a MyHealth record. The patient or their representative, if the patient or representative requests that it not be uploaded, then you don't need to do that as well. There is reasonable concern for patients' health, safety or well-being, but you won't need to upload to the MyHealth record. And if there's a technical system or issue preventing upload, that's all right as well. However, where an exception is relied upon, evidence must be retained for 2 years. Accessing results in MyHealth record for patients. Consumers can access results directly from Health record and set controls, as you can see on screen. They can set controls in the MyHealth record to choose who can see their test results in their record. They can remove or hide their test results. They can ask the provider to select the Do Not Send to MyHealth record button, and they can advise pathology or radiology staff not to upload results to the MyHealth record. In summary, the better and faster access reforms were introduced to support a more connected Australian health system. By reducing duplication and delays, these changes help avoid unnecessary repeat pathology and imaging, minimising time lost in missing results, and reducing the administrative burden of tracking information down. This improves efficiency for clinicians and reduces frustrations for patients. Most importantly, shared information supports better continuity of care. As patients move between general practice, hospitals, specialists, allied health, and community services, the risk of information loss increases. When key clinical information is available across settings, care becomes more connected, safer, and more consistent with less guesswork for clinicians and smoother, timely care for patients. I'd like to now briefly touch on the 1-800 Medicare app, as you may not be aware of the changes. The 1-800 Medicare is a government initiative aimed at improving access to primary healthcare for all Australians. The service provides a free nationwide health advice line and after-hours GP telehealth support and around the clock. The 1-800 Medicare app is an extension of this government initiative. It's essentially an updated version of the previous My Health app. It hasn't replaced My Health Record, and it isn't a completely new product. You still have access to your key health information, it's a trusted advice, and pathways to care all in one convenient place. Through the app, you can continue to access your key health information, seek trusted evidence-based health advice, and connect with care when and where you need it, all from a mobile device. Over time, new features will be added, including in-app notifications for preventative screening, access to reports from your tests and scans. If you previously downloaded the My Health app, it may have already updated automatically. All the health information uploaded to your My Health record will still be available in the updated 1-800 Medicare app. The purpose of the app is to provide key health information in one convenient place. It's designed to guide consumers not to diagnose conditions or manage ongoing care. Advice provided is situational, not long-term clinical care. The app's care pathways support self-service care and provide links to the most appropriate next step, whether that's your GP or primary care service, after-hours care, urgent care clinic, or emergency services if need. On screen are the sources of information the patient can access to which can also help you as clinician, such as access to Medicare information and links on how to enroll the claim, ability to view electronic prescriptions and active script list, access to vaccinations and immunisation history, and find and book a health service if you need to, and that's a full list actually on the screen for you. That's the end of my presentation tonight. We work as a team across practice support, digital health, and immunisation, and on screen is our contact details. We can actually support you across a wide range, including practice nurses, My Medicare, the actual program, digital health, PIP-QI, quality improvement activities. So please do reach out. And I suppose, Kayla, just wondering if there's any questions that I've been asked tonight.
Yeah. So we did have a question, and it was just around how can providers look up which pathology and diagnostic imaging providers are using My Health Record?
Fantastic. So as I mentioned before, so those uploads have already started since October 2025. And there is actually a link with regards to a full list available on the Australian Digital Health website. Kayla, would you mind putting that actually in the chat for everyone? But we can also send that out. Just
Yeah,
to give
sure.
you an idea, pathology reports, I'll give you a few of the main ones. So Foresight Pathology is already sharing that data, Douglas Hanley Moir, Lavity, QML, and Sullivan Nicolaides Pathology as well. These are in New South Wales. When it comes to diagnostic imaging, for New South Wales, and there's quite a few that are available. And that when you get the chance to look at that full list, you'll be able to see it. But some of the notable ones are Imaging Plus. That's actually Marimbla, sorry. iMed Radiology, you might be familiar with. Just Ultrasound, Loomis Imaging, Macquarie Medical Imaging, and I'm just naming a few here. Um, sorry, I'm just trying to choose ones that are relevant to our region. Aspire Radiology, you might be familiar with. But there's actually probably a list of about 20 across the region, across New South Wales, actually. So quite a few are jumping on board, and the requirement is for radiology to have that conformance of uploading to the My Health record share by default by June or July, sorry. Any other questions at all?
No, that was the only question that we had today.
Awesome. So thank you for your time tonight. I hope you found that presentation useful. Please do reach out to us if you need any support or you'd like any further information. And have a great evening. Thanks so much.